Hi, this is Andrea Kane, and I'm here with you for HIT 292 Reimbursement Methodologies. We are on week 2, but we have moved on to chapter 3, which is number 2 of our 3 lecture videos for this week. If you want to follow along in your textbook, I'm on page 35, Government-Sponsored Healthcare Programs. So let's take a look. Our learning objectives are to identify the different government-sponsored healthcare programs, recall the history of Medicare and Medicaid programs in the United States, determine cost-sharing responsibility for Medicare beneficiaries, and describe the effect that government-sponsored healthcare programs have on the U.S. healthcare system. So let's talk about Medicare. This is Title 18 of the Social Security Act. It came into being in 1965, was implemented in 1966. The beneficiaries are those who are age 65 and older, eligible for Social Security or railroad retirement benefits, persons with permanent disability of any age, and those with end-stage renal disease of any age. Parts of Medicare, there are 4, Part A, Part B, Part C, Part D, and you do need to know these. Part A is always going to be hospitalization. Part B is voluntary supplemental, or just think of it as outpatient. So Part A is inpatient, Part B is outpatient. Part C is if you choose Medicare Advantage. It's a managed care option that combines Parts A and B. Part D is outpatient prescription drug coverage. So let's look at Medicare Part A. If you're looking at page 36 in your book, table 3.1 is there. Hospitalization insurance is covered under Medicare Part A. It is provided with no premiums. The cost sharing includes deductible, co-payments, and co-insurance. The services include acute care inpatient, long-term care, skilled nursing facility care, and hospice. So even though we think of Medicare Part A as inpatient care, you also have to know that it includes long-term care, skilled nursing facility care, and hospice. Medicare Part B is voluntary supplemental insurance for the outpatient side of life. It includes physician services like physician office, outpatient hospital services like the ED, outpatient surgery, urgent care, rehab, those types of things, as well as medical supplies. And this table is so hard to see, but it's on page 37 in your book. Medicare Part C is Medicare Advantage. That's managed care for both Parts A and Part B. And many Part C plans also will provide Part D. The plan requires a premium, may have cost-sharing provisions depending on which plan is selected by the beneficiary, and it has an expanded scope of services, including custodial care, dental services, vision services, health and wellness services, and hearing aids. Part D is that outpatient prescription benefit, drug benefit. It's administered by prescription drug plans and Medicare Advantage plans. There are premiums, deductibles, and co-payments. There's also a coverage gap known as the donut hole, and you'll want to read about that in your book. That is on bottom of page 38, top of page 39, where you can read about that and what that is. Medicare supplemental insurance is to cover items and services not covered by Medicare. It's offered by various insurance providers, and it has to meet federal guidelines. It's also known as Medigap insurance, and that's Medicare supplemental. Medicaid is Title 19 of the Social Security Act from 1965. This is for individuals and families with low incomes and limited financial resources. It is a joint program between federal government and states. That is different than Medicare. Medicare is not a joint program. It is. I'm sorry, but somehow it looks like my microphone stopped working. So I'm going to go back and cover this. I apologize if I'm covering it a second time. But Medicare supplemental insurance is supplemental insurance that covers items and services not covered by Medicare. It's also known as Medigap. It's offered by various insurance providers, and it has to meet federal guidelines. One thing about Medicare is a federal program only. Let me go back up here. It's federal only. It doesn't involve the states. It's federal only. And that's different than Medicaid. Medicaid is Title 19 of the Social Security Act. It is to benefit individuals and families with low incomes and limited financial resources. It is a joint program between the federal government and the states, administered by the individual states. So it varies from state to state, whereas Medicare is federal only, so it is the same. Anyway, with Medicaid, they determine the eligibility, type, amount, duration, and scope of covered services, and they often offer a managed care option. Most states do. Medicaid requirements, they are required to provide coverage for poverty-related infants, children, and pregnant women, and deemed newborns, as well as low-income families, families that are receiving transitional medical assistance, children with Title 4E adoption assistance, foster care, or guardianship care, as well as children aging out of foster care. The elderly and disabled individuals who receive Social Security income, and aged, blind, and disabled individuals who live in 209B states, those are also covered under Medicaid. They also include certain working individuals with disabilities and certain low-income Medicare enrollees, such as specified low-income Medicare beneficiaries. Those are all under Medicaid. They're all determined by the state, not the feds. There is a Medicaid program called PACE, Programs of All-Inclusive Care for the Elderly. This is a joint Medicare-Medicaid venture. It offers states the option of creating and administering a managed care option for the frail elderly population in the community. The goal is to help them continue to be able to live in their own homes and communities, have service facilities in various geographical service areas so that there's increased accessibility. They want to try and improve the quality of life for frail elderly individuals. CHIP is the Children's Health Insurance Program. It is part of Title 21 of the Social Security Act. It is a state-federal partnership that targets the growing number of children not covered by health insurance. Like Medicaid, CHIP varies from state to state, and requirements for services that must be provided vary, and there are requirements limiting cost-sharing provisions. There are almost 10 million children currently enrolled in CHIP. Moving on to TRICARE. TRICARE is for active duty. TRICARE is active duty members of the military and qualified family members, as well as those Guard or Reserve members who have been activated. So be thinking TRICARE is active. TRICARE is active. It has comprehensive coverage, outpatient visits, hospitalizations, preventative care, maternity, immunizations, mental and behavioral health. There are a wide variety of options, and I'm not going to make you memorize these. You just need to know that there are just an enormous amount of options. Veterans Health Administration is exactly what it says, veterans, not active, veterans. And the VA is the nation's largest integrated healthcare system. They have over 1,200 care sites. They serve over 9 million. I am so sorry, but my microphone keeps misbehaving tonight, and I'm not sure why. But anyway, the VA is the nation's largest integrated healthcare system with over 1,200 care sites, serving over 9 million veterans each year. It is little or no cost to its members, and coverage is based on priority groups. And it says figure 3.3 in your book. And I'm trying to see where that is located. That would be page 45, top of page 45. Anyway, private insurance can be used to supplement VA benefits. So many veterans do choose to have supplemental private insurance. There is also what's called CHAMP VA, and that is for dependents and survivors of permanently and totally disabled veterans, survivors of veterans who died of service-related conditions, and survivors of military personnel who died in the line of duty. So those are all covered under CHAMP VA. If a family member qualifies for TRICARE, that trumps everything else. If they don't qualify for TRICARE, then they may qualify for CHAMP VA. and they are then treated at participating VA healthcare facilities. They do have some deductibles and cost-sharing provisions, but it gives them that coverage. The next part of the government system to be aware of is the Indian Health System. And we actually have Indian Health System facilities here in Iowa. The Indian Health System covers American Indians, Alaska Natives for preventative health services, primary medical services, community health services, and rehabilitative services. So that is all part of that. Workers' compensation is another aspect of governmental plans. Workers' comp covers work-related injuries or illness. It covers the healthcare costs and lost income. It is legislated by individual states. They set the coverage for burial, death, income, medical, all of that. So workers' comp, but that's state again. There is a Federal Employees Compensation Act that was established in 1916, and that is for federal employees, just what it says, federal employees. That's different than regular workers' compensation. And an example would be postal workers. So patient connection. This is Malachi, our example patient who was enrolled in Medicare, and it's going to walk you through his situation and how to calculate his medical care. And if you want to look at this in your book, it's on pages 46 to 47. And that is it for Chapter 3. Thanks.